post-operative phase extends from the time the client is admitted to the post-anesthesia care unit to the time he is transported back into the surgical unit, discharged from the hospital until the follow-up care. Goals of care during post-operative period: maintain adequate body system function, restore homeostasis, alleviate pain and discomfort, prevent post-operative complications, and ensure adequate discharge planning and teaching. Upon transferring the patient to the post-anesthesia care unit, the nurse communicates intraoperative information by identifying the patient's name, recording the surgery performed, and identifying the type and amounts of anesthetic and analgesic agents used. Monitor vital signs every 15 minutes until condition is stable. Observe signs and symptoms of shock and hemorrhage. Blood pressure dropping 5 to 10 millimeters per mercury with each reading must be reported as soon as possible. Cool extremities, decreased urine output, slow capillary refill, tachycardia, narrowing pulse pressure are often indication of decreased cardiac output. Maintain patent airway and adequate respiratory function by placing the client in a lateral position with neck extended or back with the head turned to the side to prevent aspiration. Continue close monitoring of patient's physical and psychological response to surgical intervention. Administer medications, fluids, blood component therapy, and pain relief measures if prescribed. Provision of post-operative discharge instructions is of primary importance that the nurse ensures during the extended post-operative period. Instructions should be written by the physician and reinforced verbally by the nurse. A provider telephone contact should be included, as well as information regarding follow-up care and appointments. Instructions should be signed by the patient, provider and nurse, and a copy becomes part of the patient's chart. Forms and procedures for discharge instructions may vary per facility. Remove the old dressing and assess after removing it. Note presence of broken sutures, edges of incision pulling open, bleeding around the incision, redness that extends more than 1 inch from the incision edges, increased skin warmth, swelling, and foul or sweet-smelling incision discharge. Clean the incision by using a clean gauze with povidone iodine. Start with the area with the incision and wipe outwards or away from the incision. Use a separate part of the gauze each time wipe the skin. Do not scrub or remove any scabs. Do not wipe or rub over stitches, staples, or skin closure strips. Pick up the gauze pad and carefully cover the incision with the pad. More than one gauze pad may be used if fluid is still coming out of the incision site. Hold the gauze pad in place and tape the dressing. Use basic comfort and precautionary measures by draping the patient back and raising the side rails.